Hey friends, today I'm excited to have one of the leading faculties of medicine in our country, Dr. Rahul Rajeev sir, who is the faculty of medicine at DocTutorials. He started his teaching experience right during his undergraduate years, and he himself scored single-digit ranks in both NEET postgraduate examination and the super specialty examination. Currently, he is working as a neurologist as well, and most importantly, he has been one of my mentors who supported this channel right from the beginning itself. So I'm just excited to have him here. Before we jump on to the interview, don't forget to hit the subscribe button, watch this video and share it to your friends as well. So let's move into the interview. I'm excited to interview Dr. Rahul Rajeev sir, who is the medicine faculty at DocTutorials. Plus, he's been one of the mentors who has supported me from the beginning of this channel as well. He's a neurologist by profession. So without further ado, let's just start the interview.
Hello, Dr. Omer. Thanks a lot for inviting me for this interview. It's a pleasure to be in this channel, and I'm really impressed by the kind of videos that you are doing in this channel. And I hope that this channel reaches more medicos and informative videos. More and more interactive videos are hopefully on the way.
So let me just jump into the main question of this video. That is, how does a UG student during his MBBS days, how should he or she approach a huge subject like medicine? We know that medicine is different from the other subjects, that we need to have a separate preparation for the practical exams and for the theory exams. So should we actually start studying right from our second year itself, or should we wait till the final year to start preparing for medicine?
First we'll discuss about the theory preparation. So again, with medicine is the vastness. Now, if you ask me, I appeared for MD medicine exam, that is of MD, preparing for the final MD exam. Was I thorough with all systems of medicine? My still no. So if, someone who has done medicine 24/7 for 3 years cannot finish. Obviously, a final year student will have limitations. But here, I think you have got to go for a bit of smart study. What I would suggest to my dear students is that when you approach medicine for theory exam, for each system, for example, let's take cardiology. You do your previous quests. You might have a system-wise arrangement of previous year quests. You try to find out what are the high yield areas. Now you will find that with regards to essay questions, yes, there have been essays being asked from, say, infective endocarditis. Now this gives you an idea that infective endocarditis is a very high yield topic. Similarly, you might have short note from atrial fibrillation. So you get an idea, oh, this is very important. Similarly, a topic like JVP, you might be asked to draw the waves of the JVP. So you first go through the high yield topics. Now, when you go high yield topic, it gives you which all areas to focus. Now, after identifying high yield areas, you start your preparation, because that will make your study a bit more focused. The problem what happens is when you just start with a subject like cardiology, which is a vast ocean, it's like wandering in a big forest. You have got so many paths, you can go in any path. So it is slightly difficult. So I think a more focused preparation. So identifying the key areas, and once you finish those high yield topics, it gives you a bit of satisfaction as well. Okay, whatever has been asked in the university question papers in the past with regards to this system, I have covered it. So after that, maybe a few other topics also you can read at your leisure. But again, I think since you have got a big exam coming up, that is a university, you need to finish all the topics. So the message is clear. Identify the high yield topics from each system. You start your preparation accordingly, covering those high yield topics, and that actually will help you focus your theory preparation. And also one last point regarding that. See, when you learn a particular topic, you learn only according to the weightage. For example, suppose I have got a short note of pulmonary hypertension. So when you prepare for pulmonary hypertension, I can even study pulmonary hypertension for hours and hours. You can look at the latest trials, the advances. But again, for a final MBBS student, he has to draw a line. So he has to understand, okay, this is expected as a short note. Someone can even ask me the clinical findings and the examination findings of a pulmonary hypertension. So that is expected as a question during my practical examination. So I think you've got to study according to that, which will help you in easy revision. Otherwise, if you go for a full-fledged A to Z study, revision also might be tough. This is what I have to say about the theory preparation. Okay. Now coming to the practical preparation. So the suggestion regarding the practical preparation is, many students ask me, sir, is there a definite book from which I can learn history taking? So I say that more than history taking, it is most about symptom analysis. Now, I also get students asking me, sir, how to take a history of a patient with mitral stenosis, how to take a history of a patient with COPD. See, it's not like that. It's not taking history of a COPD. It is how case of breathlessness, how you approach case of chest pain. So you need to first learn to analyze each symptom. And from each symptom, you need to know what all questions to ask. And you need to know why you are asking those questions as well. Remember, when you take history, what you get is a raw data. And as a student, what you have got to do is, you have got to analyze this data properly and then come to a single diagnosis or a differential diagnosis. So you have to learn about symptom analysis. So for symptom analysis, I'm actually of the conventional viewpoint that you have got to attend maximum ward classes, present maximum cases, which I think is lacking in the current generation. I should say that maybe people are more focused towards entrance preparation. So I think the quality of history taking, the analysis of symptoms, narrowing the differential diagnosis and putting that differential diagnosis in order. Okay, this is my first diagnosis. I think that is an art and it requires some effort for it. So that is first regarding symptom analysis. Next is regarding examination. Now, regarding the examination of various systems, see, say cardiovascular system or neurology. First, you have got to understand how to examine in a proper order. So if you say take neurology, for example, so you need to know the exact format of examination. So you have got to learn that first. And learning is not all about, you've got to you can even practice in a normal person, maybe your friend or your parents, you can just practice a normal examination so that it is there in your mind. So don't think that once you read some examination in a particular order, you can do it in the exam. To do it in the exam in an exam environment, if you have got to do it quickly, you have got to practice it multiple number of times. So please, the system examination, you read it, you understand, you practice, and then that becomes a routine. And from there, you try to understand, okay, what are the abnormalities that I can get, and how to correlate the examination findings with the history. Remember, when you come to a diagnosis in medicine, it is not just about dissociating the history and examination. You've got to associate your history and examination. So that it is like it goes in a single line. So that is what you have got to do regarding the examination part as well. And I think the most important advice regarding practical is, please present more cases. You have got to remove all the inhibitions. And I strongly believe medicine is not learned from textbooks, not from any recorded lectures or live lectures alone. They can help you, they can guide you, but I feel medicine is always learned in the wards. So this is my advice on preparation for the theory exam and the practical exam.
Yeah, I guess everyone has understood the importance of clinics. Like me personally, for the practical side, we all try to read different textbooks like Hutchinson, MacLeod, and many Indian other textbooks as well. But I don't think the discussions that we had in our wards, that is the highest yield material which we use for our practicums. Also, like Sir said, the importance of taking the cases and presenting it. One thing which I think that we all face is the issue of time limit during our practical examinations. So to complete a case, like for example a neurology case, 45 minutes is the time that we have here for a practical examination. Unless and until we have the habit of taking that case, writing it down and presenting it is almost very, very difficult to complete it within that time frame as well.
Yeah, absolutely right. And let me be very honest, Dr. Omer, even after completing a DM in neurology, if you ask me to quickly take a case in 1 hour, I'll struggle. Not even 45 minutes, I'll struggle. So, that's it. There are limitations, but again, you have got to, in a world with a lot of rat races, you have got to run along. That's it.
Thank you, sir. So over to the next question. We have now discussed about the MBBS days. Now, after MBBS, once you start internship, or after that, when you're preparing for the next exam or the NEET PG examination, how should you approach a huge subject like medicine? As we know, we have 19 other subjects to cover as well. So how should we be preparing? How much time we should spend for medicine, and what would be the most effective strategy during those days?
Right. So for entrance preparation as well, again, the problem is the same, vastness. It's a very good subject to learn, I should say, but it is vast. So here again, smart work is important. The same strategy for final year, we went through the previous questions first, correct? So for medicine as well, have a glance through the previous question. I will not tell you that just study some last year questions by heart and go to the exam. No, the aim of glancing through the previous year questions is you get to know what are the previous year topics. So you know that, okay, these are the topics that I've got to focus more. So when you learn medicine, again, when you learn, there are two ways of doing it. Some students, they do questions, MCQs, one after the other. Some students keep on reading. Please strike a good balance between your theory preparation and your entrance preparation. I mean, your MCQ preparation. So what I would suggest to a candidate, on a day, if you study, what I give advice to my students is 70% of the time you can read, but 30% of the time you practice MCQs. If you are weak in doing MCQs, or you have got some serious problem, when it comes to MCQ exams, maybe that 30% can be 40%. Now, you identify the high yield topics, start with each system, give more importance to those high yield topics. And when you practice MCQs as well, there are different apps available, different platforms available. You have got question banks, and question banks have lots and lots of questions. Students ask me, sir, should we do everything? What I would suggest is focus more on the easy and medium questions mostly. Because sometimes what can happen is that since the subject is very vast and you can ask the question in any level, sometimes when you get a few very tough questions, you tend to be demoralized. So I think if you focus more on the easy and medium, your basics are good. And then you get more confidence as well. And then you go to the slightly tougher questions. But if you straight away start with, you listen to some random lecture and then practice some tough questions, slightly might demoralize you. So what I want to tell you is, you practice MCQs. You must understand that in entrance exam, it is not about doing extraordinary things. Omer, during my UG entrance exam as well, I had got a single digit rank. Even for super specialty exam, entrance exam also, I got a single digit rank. But let me be very honest, in these exams, I never felt I did something extraordinarily. I felt that I did the ordinary things in an extraordinary manner, which means all the easy questions and medium range questions, I got it right. And there were a few questions I was totally clueless about, but I was fine with it. But the problem happens when you see some questions, you are confused. So don't confuse yourself. Already the subject is vast. So try to keep it simple. Previous year topics, once again to summarize, previous year topics, identify. You can watch lectures. Now you might ask me, sir, how much time for lectures? Now some students, if your basics are not thorough, I would suggest please go through video lectures. Just practicing lots and lots of questions won't do. So you have to analyze yourself, how good you are in medicine when you practice MCQs. If your basics are not strong, you have to go through the video lectures, understand the concepts, and then only practice the MCQs. If you're someone who has done medicine reasonably well in your final year, you start off with MCQs. Obviously, there will be certain areas where you feel, no, I'm not able to answer this confidently. You go back to the video lectures. But again, it's about smart study. Hard work is important, but I still believe it's more about smart study and better organization.
Thank you, sir. Now, the next question is, I have heard Dr. Rohan sir say that the people who should go into surgery are those who are born as surgeons. So in a similar way, what should be the kind of people who should choose general medicine as a postgraduate, or who should be a general medicine physician in their life?
Right. I completely agree with you. Dr. Rohan sir, I think he's a very good friend of mine as well. And I know his mother as well. So I'm more friends with his mother. She was in Calicut a few years back. We had met, including my family. So we know each other for long. And so coming to your question, see, for medicine, some of them choosing medicine might be a love marriage, that you already decide in your final year that, okay, this is what I'm going to do. I'm so fascinated by this subject. I'm going to take medicine. For some of you, it might be an arranged marriage. Medicine may be one of your options. You give your entrance exam, you get a rank, and then you think about, okay, then why not medicine? So whatever be the scenario, let me tell you, medicine, the journey is exciting. I'm not saying it is without any hurdles. The amount of time that you have got to dedicate, the amount of effort, the free time that you get might be relatively less during residency. But whatever said and done, I think it's a beautiful journey, and you will enjoy the process. But what I want you to understand, that the advice I want to give all of you is that never choose medicine just because you like medicine for your theory exam or practical alone, because that is the learning part. You've got to enjoy medicine as a branch, a career. So you must visualize yourself as a physician or a super specialist. So some people, might say, I like psychiatry as a subject. But when you want to choose psychiatry, you must think about psychiatry as a branch, psychiatry as a career option. So just because a subject is appealing to you for learning, it necessarily might not actually suit you as a career option. So I think you should talk to others, find out how the journey is. I think always talking to others who have already traveled the path before is a very good thing to do. So okay, what to expect. How is residency like? And after that, what about super specialization? How are the career options? What about the settlement? So I think, it's always good to have a conversation. But as I said, love marriage or arranged marriage, the journey is beautiful. That is what I should say.
I think this is my personal view on this. I do feel that the career guidance is comparatively lesser in medical colleges. Most students are clueless as to what the lifestyle of each specialty is unless they are into the PG preparation, or even during this PG counseling. That is when most people decide on what specialty that they have to take.
Right. Absolutely right. I totally agree with you. I think what I strongly believe is, along with final MBBS or internship, even faculties at medical colleges also have got to interact with students, at least in their postings, on what you want to become, and just give them that insight as well. So I think, that part we have got to focus. I completely agree with you.
Now, coming into the next question, what does the future of general medicine look like in India? Like we are hearing these days that even a super specialty like neurology, cardiology, even these branches are starting to get saturated. That is what I have been hearing, especially from some of the neurologists and cardiologists which we met during our electives in our college. So is this really true? What does the future look like?
So suppose you're done with MD or DNB medicine, you can choose to remain a physician. You can then go for super specialization as well. Regarding the option of staying as a physician, I think the options were more, say, a decade back. Why I say this? Because now you've got emergency medicine as a separate segment or a separate specialty. So what happens is, once emergency medicine branch flourished, and it's still flourishing as well, I think many of the hospitals for the emergency care started depending on emergency physicians. So previously, these posts were actually given for physicians. So this actually slightly cut down some of the exciting opportunities for physicians, that I should say, to be honest. So, but still, there are people who are successfully practicing as physicians, because I am strongly of the belief that, see, though there is a super specialty trend, you will still have a role as a physician. But again, this depends on where you work. Many students ask me, sir, I heard that being a physician, you cannot work at all. It's just like you're sending some consultations alone. I think it's where you work. Suppose you work as a part of a corporate hospital. In that case, maybe for every case, there is always a medico-legal angle to it. So even if a patient is admitted with pneumonia and there is a slight increase in creatinine to 1.5 milligram per deciliter, you are supposed to send a nephrology consultation, even though you know that, a small acute kidney injury can occur along with an infection. But when you look at the peripheries, you look at the, some of the farther parts, like away from the major towns, there is a good role for physicians. And I personally know many physicians who make good practice, in that locality. So it's about where you practice as well. There are certain limitations, as you said, regarding, practicing as a physician alone. And I told you the reason as why as well. Now, regarding the question on super specialization. Now, is it a necessity? As I said, nowadays, the trend is more towards super specialization. Let me be very honest. I've got patients who come to me for some neurological problem, and they ask me, sir, can you give me a gastroenterology consultation as well? I said, what happened? Now I'm having some gas problems. So I have spent 3 years learning MD medicine, and for writing a pantoprazole and omeprazole, I should give the patient a gastroenterology consultation. But that's how it is. Patients have that perception that a cardiologist only deals with chest pain, and a neurologist deals with headache, and gastroenterologist deals with gas. So that is a general perception.
Yeah. Thank you, sir, for your insight. Before we end this interview, I would like to have a rapid fire round where I'll be asking simple questions, but your answer must be quick and mostly within 1 or 2 sentences. So let's start.
Yes.
So the first question is, do you prefer to be a teacher over a physician?
Being a physician is my priority.
Okay. The next question is, what is your favorite hobby outside of medicine?
Cricket. I'm an ardent cricket lover.
Okay. That's nice to hear. The third question is, how would you describe neurology as a specialty in 1 sentence?
Neurology, I think, it's a fascinating journey. That's what I would say, because fascinating journey with lot of ramifications. You can be an epileptologist, you can enjoy movement disorders, so lot of ramifications, fascinating journey.
With all the information that you have right now about medicine and being a doctor, what would be one advice that you would give to your first year MBBS self of yourself?
Well, I would tell that enjoy life, enjoy the journey, and the biggest luxury in life is a peaceful sleep. So along with all the career ambitions that you have, enjoy the life.
Okay, that's a great advice. Now the final question of this rapid fire round and of this interview would be, if you did not choose this path as a doctor, what would have been your alternate career pathway?
I wanted to be an IAS officer. I was during 10th standard, 11th standard, I wanted to be a collector. When you see all those Mammootty movies, I have always felt I should also be a collector. So I would have been an IAS officer.
Okay, with that, we end this interview. It has been an amazing session. Thank you, sir. Thank you for accepting my invitation. It's been a great honor to speak with you. So that's it.
Yeah, thank you lots, Omer. But I also want to tell you, I think your journey, you are special. I've told you this before as well. And I think from your side to the field of medicine and lots more, I think more is yet to come. That's what I strongly believe.
Yeah. Thank you, sir. Thank you. If you watched this interview, do hit the like button and follow for more such content. It's Omer Mohammed. Until next time, see you soon.